first, gather all equipment, pen light, tuning fork, square chart, gloves, alcohol, and handheld visual chart. So, explain procedure to the client. So now you're going to assess their eyes and ears to ensure that there's present all abnormalities in your eyes or ears. So first is to perform the test of instant visual acuity again using Snellen chart. The normal acuity is 20 with or without maximum. So the patient right eye is 20/30 without glasses and glass one. While the right eye is 20/25 with glass one. With both eyes is 20. So next is the mirror visual acuity using handheld visual chart. The normal acuity is 14/13 with or without glasses. So the client is able to read the handheld visual. Next is test peripheral without test the peripheral vision or the visual field. Tapos ito naman, stop here. Nakita mo. So both eye are dedicated to the parallel eye. Next is perform extra ocular muscle. First is corneal right reflex using sunlight to observe parallel alignment of light reflection on the lids. So, the position of the light in the corneas is positioned in the same spot, which indicate normal parallel alignment. Next is cover using opaque part to cover an eye for observe or eye movement. Next is position test, observing for eye movement. Ma'am, don't move your head and follow me. inspection of external eye structure. First is inspect eyelids or and lashes for position and palpebral feature, ability to close the eyelids, dilation of the eyelids, and the comparison of eyelids. So the eyelids is the skin is intact, while the lashes is well distributed. The client is able to close her eyelids. Next is step positioning of the eyeball. If it is sunken or so, the position of the eyeballs is normal. Next is step upper conjunctiva and sclera. So, the upper conjunctiva is pink, while the sclera is white, and the color of the bulbar conjunctiva is pink, and the texture is smooth. Next is inspect the palpebral conjunctiva. So the color of the palpebral conjunctiva is pink, and there is no lesion or um, green. Next is inspect the lacrimal apparatus for swelling and redness and bleeding. So the lacrimal apparatus is uh, there is no redness, swelling, or any discharge. Next is palpate the lacrimal apparatus for nothing but leakage. So the lacrimal apparatus of the patient, there is no presence of bleeding. Next is inspect the cornea and lens by shining a light to determine transparency. Inspect the iris and the pupil for shape and color. So the color of the pupil is black, while the iris is color brown. The texture is smooth. There is no appearance. Next is test papillary reaction to light in a darkened room. Have the client focus on the distant object, shine a light obliquely into the pupil. So the pupil constrict and dilated when the light is over the eye. Uh, Next is test the accumulation of pupil by shining the gaze from far to near. Not far. So the pupil constricted when the object is over the face. Next is inspection of the ears. Inspect the auricle, tragus, and lobule for size, shape, position, coordination, and discharge. Inspect external auditory canal, um, auditory canal with endoscope for discharge, color, consistency of urament of canal walls. So the ears is equal size without swelling. The skin is intact. Next is palpate the auricle and mastoid process for tenderness. So there is no pain while palpating, and there is no abnormal swelling or tenderness. Next is perform the whisper test by having the client place one finger into the tragus um, and 1 to 2 feet over behind the client and whisper 2 syllables. Diba? Perform the Weber test by using a tuning fork, placing the on the center of the head or mastoid of the head or forehead, and ask the client whether the client hear the sound better in one or both knees. So the client is so the client able to hear the sound in her both. Next is perform rhyme test by using tuning fork and placing in the base of the client's password process. When the clients no longer hear the sound, immediately place to the ear. Note for the time interval and move it to the front of the external ear. When the client no longer hear the sound, note for the time interval. The left side area is 4 seconds, while the ear area is 9 seconds. Next is perform the Romberg test to evaluate the equilibrium group. Feet over together and arms in the side. Close the eyes for 20 seconds and observe for 20.